Hi, my name is Kristen Harper. I'm the Policy Director at Arkansas Advocates for Children and Families, and I've been asked to talk to you about hunger and food insecurity issues that were addressed during the 2025 legislative session. We'll start with a big win that we had, which is universal free breakfast. We're thrilled about Act 123 because this means that any child in public school, regardless of income, now has access to a free, healthy meal each morning. And this is going to go a long way in our state. Unfortunately, we are the state with the highest food insecurity rate in the nation at 18.9% compared to 13.5% nationally. And so now with this, it will, one, remove stigma that might have been associated with kids who qualified or didn't qualify for free breakfast, and make sure that kids have full bellies in the morning. And we know that helps to promote better attendance as well as better academic and behavioral outcomes. And three, it's one small step toward reducing the food insecurity rate in our state. So I'm very excited about this win for kids. Next, we're going to talk about the lows. The example I'm going to use here is SB 217. Now, this piece of legislation is a little wonky, which I'll explain in a minute. But SB 217, what it does is require the Arkansas Department of Human Services to request a waiver from the United States Department of Agriculture each year until we get this waiver, which would make certain foods ineligible to be purchased with SNAP benefits, namely soda and candy. So this bill did pass, but it's kind of moot now because actually on the same day this bill ran in one of the committees, the governor did submit a waiver to USDA. That waiver was subsequently approved. Now that waiver was more than just candy and soda. It also included any fruit or vegetable drink that had less than 50% natural juice, as well as any unhealthy drink, which is not defined in the waiver or the law. And so the Department of Human Services is now working on implementing that. It is scheduled to go live in July of 2026. And of course, our concern with this is that it unnecessarily restricts SNAP beneficiaries' autonomy. The intent behind the bill was to try to encourage healthier eating habits and in turn produce better long-term health outcomes, right? And so while we appreciate that positive intent, we would argue this is not the way to do it. In fact, research shows that incentive-based approaches are more effective at encouraging healthier eating choices rather than restricting people's choices. As for example, the Double Up Food Bucks program, which participating farmers markets and grocery stores, they provide incentives for purchasing fresh fruits and vegetables. So, and the other piece to this is if you're trying to improve health outcomes for Arkansans, you have to remember that at any given point in time, a rough average is that only about 10% of Arkansans are receiving SNAP benefits. So if you're only focusing on that population, you're not going to have the overall outcomes that you want. If we're going to talk about improving health outcomes for kids and families, let's talk about all kids and families and not just those receiving SNAP benefits. The last thing I'll talk about is a missed opportunity that we had with HB 1915. So this bill would have made it easier for low-income families to become eligible for SNAP, the Supplemental Nutrition Assistance Program, formerly known as food stamps, because it would have increased the asset limit. The asset limit, it just means any additional assets that you may have, for example, money in your bank account, a second vehicle, that would prevent you from being eligible for SNAP. Arkansas is one of the few states that still has an asset limit associated with SNAP. And not only that, but we have one of the lowest asset limits. Right now, it's $3,000 for most people, $4,500 if you are a senior or a person with a disability. So, we would love to see that asset limit increased, if not go away entirely, so that families can save, right? In case there is an emergency that comes up, so that they can save towards something like a down payment on a house. And so we were discouraged that this did not get out of committee. It was filed very late in the session and kind of ran out of steam. It did get out of one committee, but died in the Senate. But we will look forward to working on this issue again in the future.